Bismillahirrahmanirrahim. Assalamu alaikum. This is lecture number 4 in our lecture series on urinalysis, and this is my favorite topic, uroliths, the urinary stones. Um, when we talk about urinary stones or uroliths or calculi, it means that all those mineral solutes that precipitate to form crystals in urine, and these crystals basically aggregate and grow to the macroscopic size called as uroliths. So, first, you are going to have increased concentration of some mineral solutes in the urine, and these crystals will aggregate together and grow to macroscopic size. So that means the crystals are microscopic. You cannot see grossly in your urine the crystals, but you can see the stones. So crystalluria means the presence of crystal in urine versus urolithiasis, which means that is a general term referring to the stones located anywhere within the urinary tract. If it is going to be in kidney, it is called as nephroliths. If it is going to be in ureter, it's called uteroliths. In bladder, urocystoliths, and in urethra, it means urethrolyths. So that was about terminology. The types of crystals depend upon. Uh, we are going to see the types of crystal in the next slide, but the form, why the crystals form, what are the factors on which the crystal formation depends upon. Number one, pH of the urine affects, like in which pH. There are some crystals that aggregate and form urine in acidic urine and some in the alkaline urine. Then the concentration of crystallogenic material or the urine concentration that increases. If the concentration is increases, crystal formation will increase. Number third is temperature. What you have, you get a urine sample in the lab that is fresh, but you leave it in the refrigerator and come back to tomorrow, and the next day you are going to see there are some crystals formed in the urine. So uh, it is like preferred that you evaluate the urine sample as soon as possible. Similarly, if the temperature is very high, or it can also disturb or degenerate some of the crystals, or like it is going to have, the temperature is going to have effect. Then diet related, some diets that alter the pH of the urine, they will add, or as a result they will uh, enhance the crystal or urine formation in the stone. Then some medications, same medications will also so there are some medications that could alter the pH of the urine, so same reason. Then the length of the time between collection and exam, again I have discussed this point in the temperature point. So here are the types of the crystals, and there are two types, basically acidic or basic, based on their pH, or based on the pH they prefer to aggregate and form stone. So in the acidic, we have ammonium biurate, amorphous urate, bilirubin, calcium oxalate monohydrate, calcium oxalate dihydrate, uric acid or urate stones, cysteine, and sulfur crystals. For the basic ones, we have amorphous phosphate, calcium carbonate, true white, and calcium phosphate. For this video lecture, I am just telling you the names. In the next videos, I am going to tell you the important points, or I am going to describe each of these stones in a separate video, so it will be going to be easy for you to see these. So to have those lectures, come back on the same page and do subscribe this video. Thank you so much.